So we are so lucky today to have Dr. Jagroo, who's joining us today to talk about know your pelvic floor. So she's going to be discussing what is the pelvic floor, where is it, how does it function, why is it important to keep a strong pelvic floor. Dr. Jagroo earned her doctoral degree in physical therapy from NYU University in 2002. She's one of only a few hundred board-certified clinical specialists in women's health physical therapy in the country. She's also a specialist in manual therapy and is certified in pelvic physical therapy through the American Physical Therapy Association Women's Health Section. Dr. Jagroo is an assistant clinical adjunct professor at NYU. She's on the faculty of the NYU Physical Therapy Department. She also lectures for the NYU GYN Department and the NYU Midwifery Department. Thank you so much for joining us today. We are lucky to have you again, and the floor is yours. Thank you.
Hi everyone, I'm Denise. Thank you so much for having me. I'm so happy to be here again to teach you a little bit about pelvic floor. So today is really going to be, the pelvic floor can be really complicated. You can go really in depth and talk about lots of details and all about the different layers, but we're going to keep it simple today. I'm going to try to introduce you to different aspects of the pelvic floor. Like Jillian said, where is it? What can we do to keep it strong? Why is it important? And how to find it. I think the hardest thing is how to find it. So, it's important to build awareness and control. Okay, so what is the pelvic floor? Simply put, it's a sling of muscle, and it goes from the back of the pelvis to the front of the pelvis. So it attaches kind of like a hammock, sling of muscles from the tailbone to the pubic bone, which is the bone in the front of the pelvis that's right above right below the bladder. So these muscles have actually many layers, and people think that it's just one big layer of muscle, but it's many layers that act together as a unit. So they have very important functions, but they all work together as a unit. So we'll talk about some of the different layers and why they're important. Okay, so you can go to the next slide. So you can see how they go from the back to the front of the pelvis. See in the back it says the spine. It's attaching from the base of the spine, which is the tailbone, to the front, which is where it says pubic bone. Okay, so one of the main functions is that it's supporting the pelvic organs. And when we say pelvic organs, we're talking about the bowels, the uterus, and the bladder. So one thing to note also is, and it's kind of good to see from this picture, is even though we're talking about layers and layers of muscle that support the organs in the pelvis, there's going to be a little space in the muscle to allow for the organs to eliminate its contents. Right, so the bowels need to eliminate stool, and it needs to like drop the rectum through those layers of muscle. The uterus needs to drop the vaginal canal in order to deliver a baby, and then the bladder needs to drop the urethra, the tube leading away from the bladder, to eliminate urine. Right, so you can see how those outlets pass through the muscle. And so there's a space in the muscle to allow for that to happen. So later we're going to talk about how the muscles can be weak. And when the muscles are weak, there's potential for the organs itself to come through that space, which is called a prolapse. But this is kind of a good picture to see that, because the muscles are not only supporting the organs, but have to allow for the outlets to pass through the muscles as well. Okay. You can go to the next slide. All right, so how does it work? The muscles work by contracting, so they squeeze, and sometimes they squeeze reflexively, like shouldn't have to think about it some of the time, like when you cough, laugh, or sneeze, they reflexively contract and close off the bladder and close off the rectum so that you're not leaking, right? So you potentially could leak urine, you could leak stool, you could leak gas. Right, but if the muscles are working as they should, when you cough, laugh, or sneeze, they're going to just reflexively kick in, close those organs off, and you're not going to leak the contents of those organs. Also, you can voluntarily contract the muscles, and you can do that. We're going to practice that a little bit later, but you can voluntarily contract the muscles to keep them strong and to exercise and strengthen them. So they have a kind of reflexive component, but also a voluntary component where you can voluntarily contract them yourself. Okay, and when you contract them, all the different layers contract at the same time. So even though there's separate layers, they're all working together as a unit. Okay, you can go to the next slide. Right, so they have 3 very important jobs. One is to keep you dry, what we just talked about. When you cough, laugh, or sneeze, meaning when you increase the pressure in your abdomen, those muscles should kick in, they should contract and close off the bladder, close off the rectum so that you're not leaking urine, you're not leaking stool or gas. They support the pelvis because they have to attach from bone to bone, right? So they need to contract and they need to attach from the tailbone to the walls of the pelvis, not just the pubic bone and not just the tailbone. They're kind of attaching to all the bones of the pelvis. And so they're supporting the pelvis as well. So they're supporting the organs, but they're supporting the bones of the pelvis as well. So they can get involved if you have a fall or, if you have an accident, if you fall on your tailbone, if you fall on your hip. These muscles can be affected as well because once the bones are affected, the muscles inside can be affected as well. It also contributes to sexual functioning, and that's for 2 reasons. One, some of the muscles, one of the layers of the muscles, which is at the most superficial, it actually connects right to the clitoris. So it affects arousal and orgasm, but it also, one of the layers wraps around the vaginal canal. So during orgasm or even when you're contracting your pelvic floor muscles, it squeezes the vaginal canal, and that contributes to sexual functioning and orgasm as well. Okay, so it has 3 very important jobs. And again, they contract all at the same time. Okay, so why is it important? There's different fibers that contribute to the functioning of the pelvic floor muscles. There's quick fibers and endurance fibers. And what that means is they're working with different, they're working a lot of the time anyway, because they're kind of like postural muscles. They're at the base of your trunk. They're at the base of your core. So they're always supporting the pelvis, always supporting the organs. But the quick recruitment fibers, meaning the ones that recruit and engage very quickly when you cough, laugh, or sneeze, we call those fast twitch fibers. That's not very important. But just know that there are fibers that kick in when you cough, laugh, or sneeze, but there's also endurance fibers that are working when you're on a long bus ride, when you're on a long car ride or train ride, and the bathroom isn't anywhere near you, and you have to contract the muscles for a long time in order to hold in the contents of your organs so that you're not leaking, while you're waiting to get to the bathroom. So those are endurance fibers. So whenever we're working on the pelvic floor muscles, whenever you're doing Kegel exercises, you got to work on those 2 different sets of fibers, because it's important to be able to not only hold your urine when you cough, laugh, or sneeze, but also, obviously, if you're on a long car ride or train ride, you want to have strong muscle fibers so that they can work in both scenarios. Okay, so you can go ahead and to the next slide. Okay, so how do we keep it strong? We do exercise. These are muscles just like any other muscles. They can be weak, they can be tight, they can be strong, they can have trigger points, but the problem is we can't really see them. They're on the inside. So that's the hard part about trying to find these muscles and strengthen them, is we can't see them. So we have to try to really visualize and do different exercises to build awareness. And in terms of what is a Kegel, Kegel is the name of a man, of course. He's a male OBGYN who practiced in the 1940s. And the muscles themselves, the pelvic floor muscles, are technically called the levator ani muscles. But people tend to call them Kegel muscles because this doctor, he created the exercise program, these strengthening exercises for the levator ani muscles. And so since then, people have been kind of calling them Kegel exercises and Kegel muscles. And so they just kind of named the exercise program after him. So that's when people say, do your Kegel exercises or Kegel strengthening, exercises, or work your Kegel muscles. They're talking about him and these muscles, and that's how they named it. Okay, they're muscles just like any other muscle. So if you don't use it, you lose it, meaning it's important to keep working on them throughout your life, because just like any other muscle, it can get weak if you're not continually trying to strengthen them. These muscles too, they need to be focused on and exercised often. Okay, and it's all about awareness and control. Once you can find the muscles, it's easier to strengthen them. The hard part is trying to find the muscles because they're on the inside. But we're going to try to do some exercises in a little bit to try to find the muscles. Okay, next slide. Okay, so who has a pelvic floor? Everybody does. Men always think that they don't have a pelvic floor. And it's just the, because women tend to talk about it more. I think women are in tune with it more, but men have the same muscles and they're just positioned differently because obviously they have different external organs, but they have the muscles too. And I have plenty of patients here. I work at the Veterans Hospital, and I have plenty of patients that I work with who are male with pelvic dysfunction. So we work the muscles the same way. So men and women, everyone has the same pelvic floor muscle. A statistic that 1/3 of all US women will develop pelvic dysfunction in their lifetime. This is the National Institute of Health statistic. And I mean, that equals like 50 million women or something like that will develop pelvic dysfunction. And honestly, I think like it's a very modest statistic because I think every woman pees at some time when they pee in their lifetimes. And I think people, people don't like to talk about it. There's a lot of embarrassment and shame in this topic when people are leaking, when they're leaking urine, if they're leaking stool, there's like, a lot of social anxiety that comes along with this, a lot of emotional component. People don't want to go out and go to outdoor events because they don't know if they can get to the bathroom on time, and so it's different from, say, knee pain or shoulder pain where you can't do a certain activity. This is there's so much more that I think is involved when you're leaking urine or you're leaking stool. So I think it's more and more women that are dealing with this than is reported because people don't like to talk about it. And then this is only talking about women. Men deal with this for sure a lot, and I think that there's just not a lot of information out there, not a lot of accurate information about, what is pelvic floor dysfunction and how to fix it. And even on the National Institute of Health website, it's not easy to find information about pelvic floor dysfunction, even though they're saying such a large portion of the population deals with it. So it's important to understand it, and then to know that if you're dealing with something going on in your pelvis with weakness or pain, that you're not the only one. Many, many people are experiencing it, but they just don't like to talk about it. Okay, next slide. Okay, so this is a way I'd like to kind of describe what's happening in the pelvis and why it's important. I talk about the pelvis as a boat in a dock. So think about the pelvis, the pelvic organs as the boat. So the boat would represent the bladder, the rectum, and the uterus. Okay, and the ties to the dock, what's holding the boat up, that's the ligaments, and then that's a connective tissue that's anchoring the pelvic organs to the pelvic wall. The water underneath the boat is the pelvic floor muscles that's supporting the boat and the pelvic organs from underneath. So the second picture is showing when there's no water under the boat, meaning when the pelvic floor muscles are weak and there's not enough support under the boat, there's a lot of stress on the boat itself and on the ties to the dock, meaning there's a lot of stress on the connective tissue, the ligaments, that's anchoring the pelvic organs to the pelvic wall. And there could be even a lot of stress from one part of the boat to the other part of the boat. So the boat can kind of be hanging uneven, where there's pressure from the back of the boat to the middle of the boat to the front of the boat, meaning there could be pressure from the rectum onto the uterus and from the uterus onto the bladder. So what you want to do is try to support the boat from underneath to make sure that there's not a lot of pressure on the boat and that the boat is hanging evenly in the dock, and that there's not stress on the connective tissue and the ligaments anchoring the pelvic organs to the dock. So we support the boat from underneath by strengthening the pelvic floor muscles and improving the tone of the muscles from underneath to support the organs. So you want to make sure there's a lot of water underneath the boat to try to support the boat, support the pelvic organs from underneath. Okay, next slide. Okay, so if you think about the pelvic floor is like a hammock, right? If a good toned pelvic floor looks like the first picture. So you want to think about how supportive that would be if you were laying in it. It may not be what you think you want to have in a hammock, maybe you like a droopy hammock to kind of like hug you, but that's not what we want on the pelvic floor. Just think about the image. The first picture would be if a strong pelvic floor supporting the organs from underneath. Okay. The second picture would be a droopy pelvic floor, and that's not what we want. We don't want a droopy hammock underneath the pelvic organs. We want strong muscles to support the organs from underneath. Okay. So the goal is the first picture. Okay, so we're going to do a silly little exercise, 2 little exercises here to try to find the pelvic floor. All right, and wherever you're sitting, you're just going to sit up nice and tall, and you're going to actually sit on your hands. This is going to be difficult to try to find the pelvic floor muscles, but it's kind of a way to show you that people tend to contract a whole bunch of other muscles than actually the inside muscles. So I want you to try to sit on your hands, and you're going to wiggle your butt cheeks apart a little bit, and you're going to hug your sitting bones. Try to find your sitting bones and try to have your fingertips kind of like hug your sitting bones from underneath. Okay. So you're going to sit up nice and tall, and then you're just going to close your eyes and try to imagine what I'm telling you to do here. Okay. So you're going to imagine that you're in an elevator, and you're in an elevator with your favorite movie star, your idol, whoever like you think is someone you want to meet in your life, and you are alone in this elevator with your movie star, and your movie star is behind you. You are in front of your movie star, and you realize that you really, really have to go to the bathroom because you just drank a lot of water, maybe a couple cups of coffee. You haven't gotten to the bathroom today, and you also ate a burrito, so you have a lot of gas. And so you're trying to hold all that in. Okay, so the elevator door is closed. You are in front of your movie star is behind you, but you can't look like you are trying to hold in gas or urine. So you can't clench your booty. You have to relax your booty. Okay, so you want to contract the inside muscles as if you're trying to hold in urine or hold that gas. You're going to relax your butt muscles. And if you're doing it correctly, you should feel the pelvic floor muscles contract or tense up under your fingertips, and your fingertips should be kind of hugging those sitting bones. So just try that, and try to just pay attention to how that feels, or what kind of trouble you're having trying to find the muscles, or if you're contracting, like which muscles are contracting. And maybe some of you aren't breathing right now because you're concentrating so hard. So try to breathe. Okay. Try to contract and relax. Try to do it like 2 or 3 times, squeezing and relaxing and seeing what pulls in and seeing what relaxes. Okay. So you're going to go ahead and relax. And I don't know where any of you are, but if you have room to stand up, I just want you to try this next exercise. See if you can have room to stand and still see the computer. And if you have shoes or slippers, just kick your shoes or slippers off so you can really feel the floor. Okay, and this is just for awareness. Okay, I want you to close your eyes again, and you're just going to contract the muscles like you just did. You're contracting the inside muscles as if you're trying to hold in gas or hold back urine. Keep breathing, right? And you're just standing still. And I want you to just pay attention to how that feels. Okay. Now, next, I want you to try to lean forward. So you're going to put your weight on the balls of your feet and your toes and try to contract again. So you're going to imagine almost like you're like in a ski jump, right? And you're like leaning forward. And I want you to contract again and pay attention to how that feels, because that should feel different. Okay, and now very carefully, you're going to lean back. Just put your weight over your heels. Don't fall back, okay? Make sure that you're safe, and you're just going to lean your weight back over your heels, and you're going to contract again, and you're going to hold that for just 2 or 3 seconds. Relax. Do it again, 2 to 3 seconds. Relax. Pay attention to how that feels. That should feel different from the others. Okay. Now, you can go ahead and have a seat. So what you should feel is, what you should have felt is that when you were standing, and you were contracting and you weren't leaning forward or back, that the muscles were more, the muscle fibers that you were contracting were more central, like right in the middle of the groin. And then as you leaned forward, you recruited more of the front fibers of the muscles, like around your bladder. Okay? And then when you leaned back and you contracted, you were recruiting more of your back fibers, like the ones around your rectum more. And this is important because people always say to me, that they're recruiting they're doing their Kegel exercises, and they're doing their exercise program all the time, but a lot of times they lean a certain way. They weight bear more to the front or to the back, and then they're only recruiting the fibers in the front or the back, because it all depends on how you're weight bearing. So when they are leaning forward and they're recruiting the muscles, maybe they're only working on the muscle fibers that are around the bladder. So they're keeping those fibers strong, but then they're leaking gas and they're leaking stool. So, or maybe they tend to lean back when they're doing their exercises. Maybe they're doing it sitting and they're slumping a little bit and they're only contracting the back fibers, so then they're leaking urine. So the important thing is when you're doing Kegel exercises, when you're strengthening your pelvic floor, to focus on the front fibers, the front muscles, and the back muscles. And maybe that means that you lean back or you lean forward, or you just build awareness about how you're recruiting your muscles when you're doing your exercises. So just know that there's the back fibers, right, around the rectum, the front fibers around the bladder. There's also the quick recruitment fibers when you cough, laugh, or sneeze, and then there's the endurance fibers when you're on the long bus ride or long train ride that you have to learn to recruit as well. So there's all these different fibers that you have to focus on when you're trying to strengthen your pelvic floor, not just doing like a simple contraction. I want you to think about that. Okay, so you can go to the next slide. Okay, so what did you do instead? Maybe you were squeezing your butt muscles. These are like very common things to do for people to contract instead of their pelvic floor muscles. People always tend to squeeze their thighs together instead. People tend to squeeze their butt muscles instead. They hold their breath instead, and they suck in their stomach instead. And those are all like compensatory things to do instead of squeezing the inside muscles. So it's important to try to find the muscles and then isolate them. Another thing is sometimes doctors tell people to stop their pee, like while they're peeing, to try to find the muscles. Now that's okay to find the muscles, but that's not a good way to strengthen the muscles or to like incorporate that into like an exercise program to like constantly stop your stream of urine, because that's sending the wrong signals up to the brain about like being able to relax when you're trying to urinate. So when you're urinating, the sphincter in the base of the bladder has to relax and has to open up in order for you to urinate. And that's kind of an automatic thing. That's an automatic signal. And if you're stopping your urine every time, that's sending the wrong signal up to the brain. Also, you're holding back some urine, so you always have a bit of residual, which can eventually lead to like a UTI. So you can use it to find your muscles, but don't use it as part of like a strategy, like an exercise that you do as part of your program to strengthen the muscles. Okay, next slide. Okay, what can go wrong? There's two categories of what can go wrong. It's muscles, just like any other muscle. So it can be weak, the muscles can be weak, and the muscles can be tight. And when muscles are weak, you can have issues like incontinence or prolapse. And when the muscles are tight, you can have pain. So there's two different categories. Okay, next slide. Okay, so again, weakness, you can leak urine, you can leak gas, you can leak stool. So there can be incontinence of both the bladder or incontinence of the bowels. You can have prolapse, and that is what we talked about with the first slide, seeing how the muscles support the organs, but also need to allow for an outlet for the organs to eliminate its contents. So the organ itself can pass through that space, and you can have a prolapse of either the bladder, the uterus, or the rectum, or you can have all three or two of those organs prolapsing at the same time. So a prolapse or a dropping of the bladder is called a cystocele. A dropping of the rectum is called a rectocele, and a dropping of the uterus is called just a uterine prolapse. Right? So prolapse is like a pushing through or dropping because the tissue is weak, the muscle is weak. Okay? So if you're tight, tightness can lead to pain, because when muscles are tight for a long period of time, they can develop trigger points and they can develop spasms. So that can functionally lead to pain with intercourse, pain with movement, especially with going from sit to stand, or you can have problems going to the bathroom. So just like these muscles are wrapping around the bladder and wrapping around the vaginal canal and wrapping around the rectum to close them off when you need to close them off, they also need to relax. But sometimes the muscles are so used to being tight because people hold their stress, in their pelvis, or maybe somebody had an accident or trauma or surgery, and the muscles can be really tight, and then that can cause problems going to the bathroom to eliminate urine or stool. Okay, next slide. So there's different types of incontinence. There's urinary incontinence and fecal incontinence. Like I said, it can affect the bladder or it can affect the rectum. But then there's different types. There's many, many different types actually, but I just wanted to focus on the two most common, which is stress incontinence and urge incontinence. Stress incontinence is losing urine when you're exerting yourself. So when you cough, laugh, or sneeze, there's an increase of pressure in the abdomen, and that causes urine to expel a little bit from the bladder. Urge incontinence is having some leakage of urine with like a strong desire to void. So they call this one key and lock syndrome, meaning like when you get to the bathroom or you're at your front door and you're close to your bathroom, but you can't get there in time. So you're like, maybe you're fidgeting with your keys and you're trying to get the key in the lock and the door, and you end up like expelling a little bit of urine. And that could happen because you just can't get there in time. But that's because there's, again, an increase in the anxiety causes like an increase in the pressure in the abdomen, and that causes the bladder to contract a little bit. And we'll talk about a way that you can help that by buying a little bit of time. We'll talk about that in a little bit. You can have fecal incontinence, which is leaking stool or leaking gas. Those are the two types. Next slide. So, okay, so we talked about urge incontinence, key and lock syndrome. So one way to buy yourself a little bit of time to get to the bathroom, again, if you're at the front door, you're fidgeting with your keys, you can't get the keys in the door in time. One thing you could do is practice your pelvic floor contractions, like squeezing the pelvic floor like we did. Squeeze the inside muscles as if you're trying to hold in the urine, but do it in 5 or 6 quick contractions. So you would squeeze, relax, squeeze, relax, squeeze, relax, squeeze, relax, squeeze, relax. And for whatever reason, that relaxes the bladder wall and it stimulates the sphincter at the base of the bladder. So it kind of just gives you a little reinforcement and buys you a little bit of time to get to the bathroom if the bathroom is near, but you feel like you can't get there. So for whatever reason, that works, but you have to be able to do a good pelvic floor contraction first. Okay, so next slide. So I thought we could do a little quiz here just to think about like how often you go to the bathroom, and we'll talk about like why this matters in the bladder. Okay, so when do you think the first signal goes from the bladder to the brain to tell the brain that there is fluid in the bladder? So there are sensors in the wall of the bladder, and they send signals up to the brain about when there is fluid in the bladder. But when do you think the first signal goes? When the bladder is quarter full, half full, 3/4 full, or completely full? So the answer is B, when the bladder is half full. So the job of the bladder is to store urine. And what happens often is that people tend to go to the bathroom just in case. They feel that first signal and they go to the bathroom, and they don't really need to go to the bathroom, right? It's a behavioral decision to get up and go to the bathroom. So you're definitely going to have a larger urine output like in the morning, first thing in the morning, because technically you should be sleeping through the night, and you can get up in the morning and have like a larger urine output. But throughout the day, when you get that first signal, it really should be like when your bladder is half full. So what happens is when people are going just in case because they're near a bathroom and they think that they should go and try to empty their bladder, then the sensors in the wall of the bladder reset and they start to tell your brain when there's less and less fluid in the bladder. So then you develop a habit of going often. And that's called urinary frequency. And it doesn't match like how much fluid is in the bladder, how much urine is in the bladder. So people tend to develop the habit of going often. I mean, a lot of times there is something wrong with the bladder and it could be organic and something actually going wrong with the bladder. But a lot of times it's just a habit that people develop because they go a lot just in case that they have to go. So then their bladder starts to alert them sooner and sooner that you have to go to the bathroom, and then they get up to go to the bathroom. But really you don't have to, because the job of the bladder is to store urine, and you get that first signal when the bladder is half full. And it doesn't even mean, that's also called teacher syndrome, yes. But it doesn't mean that you have to like get up and go to the bathroom, right? So the more you keep the pelvic floor muscle strong, the less you feel that you'll leak and you won't feel this anxiety about having to go to the bathroom. Okay, next slide. Okay. So how many times a day is it normal to go to the bathroom? And this is for urination, 1 to 5, 5 to 7, or 7 to 10. The answer is 5 to 7. 5 to 7 times a day, it's normal to go to the bathroom. So you don't want to be going too much, but then you also want to be eliminating at regular intervals, right? So with the next one, how long is it normal to wait in between trips to the bathroom? 1 to 3 hours, 2 to 5 hours, 5 to 8 hours. The answer is 2 to 5 hours. So you should be able to hold at least 2 hours. But then you don't want to be holding it for more than 5 hours. Like the comment before, like a lot of times I have teachers as patients, and they go the whole day, without going to the bathroom. So you don't want to hold it for too long, because you don't want to build up the urine and the toxicity in the bladder and then, develop a UTI or just affect the bladder lining. But then you don't want to be going every hour or every half hour, because then that just affects your quality of life. So you want to make sure that you're able to hold it at least 2 hours and still be eliminating regularly, within a 5-hour interval. Okay, how many times is it normal? I need one more question. How many times is it normal to go to the
I'm so sorry. I'm not really sure how to go back. Oh, okay, there we go. Sorry.
How many times is it normal to go to the bathroom during the night? 0 to 1, 1 to 5, or 5 to 10. This is a trick question. It's technically 0. You shouldn't be getting up during the night to go to the bathroom. 1 time is acceptable if you're over the age of 65, because there are age-related changes that happen in the urethra. But you want to be sleeping through the night. And I had a patient that had this is a good story to tell, to try to show you how like habits can be created and how we kind of train ourselves to go to the bathroom more often when we don't need to. I had a patient who would get up like 10 times a night to go to the bathroom, and she was always very tired in the day. She was very sleepy in the day. And I said, why do you get up so often to go to the bathroom at night? And she said, well, when I was breastfeeding my son, I just got in the habit of like every time I got up to feed him, I would just go to the bathroom. And I didn't really have to, but I just got in that habit. So I still do that. And I said, but your son is older, right? I mean, you're not breastfeeding anymore. And she's like, oh yeah, he's 7, but I'm just in the habit of getting up a lot. And I said, okay, let's go over your day. I was like, when do you go to sleep? And she's like, 10 o'clock. I said, when do you eat dinner? And she said, 8 o'clock. And I said, what do you drink with dinner? And she said, wine. She drank red wine every night with dinner. And I said, okay. And then I said, okay, so first of all, you're drinking something called a bladder irritant. A bladder irritant is anything that's going to irritate the lining of the bladder. And dehydrate you essentially very late at night. So she's drinking her wine, which is very acidic, and it's an alcoholic, obviously. So it's irritating the lining of the bladder, and she's drinking it so close to bedtime. And because she's dehydrating herself with the wine, she takes a glass of water to bed with her and keeps it on her nightstand and drinks throughout the night too. So I told her, I said, you can have your wine, that's fine. I said, but you have to have it earlier. You have to leave 3 to 4 hours between your last meal and bedtime. So I said, if you're going to go to bed at 10, you have to stop eating and drinking around 6 or 7 o'clock. But you can have your wine, but you have to have your water right after the wine, so you can like at least dilute the wine, dilute the urine, so it could be less toxic for your bladder. I said, go to the bathroom before you go to sleep, and then when you wake up in the night, I said, do you pee yourself? And she said, no. And I said, okay, so your muscles are strong enough. You're just getting up and going because you just feel this, this urge, right? It's like you trained your bladder trained you to wake up. You trained your bladder to wake you up because you responded to the signal. So I said, just ignore the signal because you're not going to pee yourself. So just go back to sleep. See if you can do that. And she made these little changes, and she started drinking her wine at 6, having her dinner at 6. She drank some water right after. She didn't take any water with her to bed. I told her to use a humidifier if she felt that the air was dry and that her throat was dry, when she was sleeping. And she said that she would wake up and she would ignore the signal. And by the first week, she was only getting up like one time a night, which is great. And then by the second week, she was eliminating getting up at night at all, which is called nocturia. And so she was able to sleep after 2 weeks, just by changing habits. She was able to sleep the whole night. And so she was a different person in the day because she was more awake. Her metabolism was different. She was like, her body was just functioning different because she was getting enough rest. So sometimes it's just these little habits of changing when you go to sleep, when you eat, when you drink, what you're drinking. It doesn't mean you have to cut everything out, just maybe shifting when you drink it, or when you when you intake water, or when you intake these different drinks that can affect how it affects the bladder and your sleep. Okay, next slide. Okay, how many times a day is it normal to have a bowel movement? 1 to 3 times a day, it's normal to have a bowel movement. So up to 3 times is normal. If you're only going every other day, that's okay. Every 2 days is constipation, and that is not good, right? It's not good for the pelvic floor muscles because you're pushing, and that causes a lot of overworking of the pelvic floor muscles, and then that leads to problems. So you want to make sure that you're regular and that you're going, up to 3 times a day or every other day. And the squatty potty is a little stool that goes under the toilet, and you put your feet on it, and it actually creates like the optimal angle for your rectum to allow for free passage of stool. So it kind of mimics like when people in those countries where they kind of just squat over like the hole in the floor. It's actually that your body's in the right position to allow for free passage of stool. When we started sitting on toilets was the problem, because then it created the wrong angle, and people have had more problems with that constipation because of that. But if you can get your knees higher than your hips, then that actually helps with like the ease of passing stool. So it's called a squatty potty. That's something people always ask me about. It is a good thing to have. Okay, next slide. All right. So we talked about weakness, and now we're talking about pain, which you can have pain with movement if the muscles are very tight, pain with sitting on hard surfaces, pain with going from sit to stand. A lot of people develop chronic pain because the muscles, are wrapping around the organ. So if the muscles aren't getting taken care of, and you're not learning how to relax the muscle and to stretch the muscle, then they can start causing problems with the organs that they're wrapping around. Remember, the muscles are wrapping around the bladder, they're wrapping around the rectum, so they can, and the vaginal canal. So people could end up with pain with intercourse because the muscles are too tight. They're wrapping around the vaginal canal. So when you have pain with intercourse, it's called dyspareunia. Dyspareunia can be in 3 different places. It can be superficial, kind of on the outside against the genitalia. The genitalia could be inflamed. They can be, the tissue can be very irritated and burning. That's called vulvodynia. We treat that a certain way. The pain can be along the vaginal canal because the muscles and the tissue are so tight, and we treat that a certain way. And then the pain could be deeper in the abdominal, in the abdomen. So there could be like a deep abdominal ache with deep penetration, and that's from reflexive spasming of the pelvic floor muscles, and that we treat a different way. So if you have pain with intercourse, it can be from from different things. You know, it can be an allergic reaction externally to your detergent, or it can be from, you know, postmenopausal hormonal changes that affect the connective tissue and make them tighter, causing pain with intercourse along the vaginal canal. Or you could have pain deep in the abdomen because of the reflexive spasming from tight muscles, and we would treat that all different ways. So it's important to kind of differentiate where the pain is coming from. Okay, next slide. Okay, what can you do about it? There's physical therapy, and there's regular physical therapy, but then specialized pelvic physical therapy, which is very different. So there are there's special equipment that we use, but in general, I always do strengthening with my patients to stabilize the muscles, right? So to try to even out the muscle forces pulling on the pelvis. So stretching the tight muscles and strengthening the weak muscles. So a good stabilization program usually helps, and sometimes that's all the patient needs. Just try to balance those muscle forces. Stretching is super important. I always do yoga, like big pelvic openers, big hip openers to stretch the muscles in the pelvis. We spend so much time sitting and in flexed positions that it's important to open up. If you believe in, you know, energy centers and chakras, you know, we hold a lot of emotional tension and sexual tension in our pelvises. So it's important to, you know, open up and release all of that and get the energy moving. Because I believe that like all that stuck energy and those like inflexible positions like really hold in a lot of tension, and that harnesses like inside of our muscles and our organs. So mind-body calming techniques, I teach a lot of like meditation to try to reset that signal going from the brain to the pelvic floor to neurologically relax the muscles. It's very important. We do that through breathing. We do that through like monitoring heart rate and stuff like that. Biofeedback, I have a unit where you can kind of see on a computer screen what your muscles are doing. There's also like electrical stimulation that you can deliver through the unit to the muscles, which can kind of reset that neurological signal and wake up the muscles a little bit. There are manual techniques that can be done either on the organs externally or internally to try to release any kind of restrictions in the connective tissue anchoring the organs to the abdominal or pelvic wall, or muscle release techniques on the externally or internally to release trigger points. There are muscle energy techniques, which is mobilizing the pelvis by using muscle contractions and using manual resistance. Behavioral modifications, basically like what we just talked about with that patient, by just changing when you drink or when you eat or, you know, when you go to sleep, and just changing habits sometimes is what people need. And sometimes they don't even realize that they've developed bad habits. There's something called dilators, and that they look like naughty toys, and we use them medically to try to stretch the vaginal tissue internally, to work on trigger points internally, or to work on tight tissue that might be compressing a nerve internally in the vaginal canal. There are exercise tools like foam rollers and physio balls that we use with patients to try to relax the pelvic floor, to try and stretch. And then functional training, trying to find out, you know, what activities the patient does during the day that they feel very limited in, and we try to incorporate that into therapy. So like if I'm working with a new mom, then I'll work on like lifting the baby, carrying the baby properly to protect, you know, the pelvic floor, strengthen the pelvic floor, contract the abdominals, and to try to incorporate whatever they're having problems with functionally to fit their lifestyle. Okay,